is intact. Now I'm going to get you to go through a few motions of your face for me. I'll demonstrate them and then you can repeat. So smile, frown, clench your teeth, puff out your cheeks, lift your eyelids, close your eyes, and now keep your eyes closed against my resistance. Okay, good. That all tells me that the facial nerve is intact. That's cranial nerve 7. I'm going to test your hearing now. And what I'm going to do is I'm going to stand behind you and I'm going to whisper 3 words. First, I'll have you place your finger over your ear and right here and wiggle that part of your ear as you're covering it. So I'll test the one side and then the other. So doing that. And then the patient says that. I'm moving around this from side to side because I can't really get behind this patient, but your patient will be sitting on the side of the bed, so you can just stand midline behind the person and have them cover each ear and then whisper back either 3 one-syllable words or 2 two-syllable words. Either one is fine. So that tells me that the acoustic nerve or cranial nerve 8 is intact. Next, I'm going to take a look in your mouth. Let me get you to stick out your tongue. And now say ah. Uvula is midline and rises with phonation, so that tells me the cranial nerves 9 and 10 are intact. I'm going to check the spinal accessory nerve now, cranial nerve 11. So turn your head into my hand as I try to resist your movement. Good. And then do the other side. Good. Now shrug both shoulders against my hands. Good. Full strength cranial nerve 11 is intact. And then the last thing I'm going to have you do is stick out your tongue. There you go. I'm looking at the tongue. It's midline. Now move it side to side. Good. I don't see any fasciculations. The movement was smooth, so that tells me that cranial nerve 12 is intact. Now I'm going to move on to checking your neck and your chest and your arms. Looking at the neck, the skin is intact. I don't see any lumps or masses. I'm gonna feel one of your carotid arteries at a time. The pulse is regular. The artery is supple, elastic. Both pulses are strong and regular. Now I'm going to take a look at your arms. So I'm just going to pull up your sleeves so I can see your arms fully. Get your arms over the sheet here. Okay. So I'm just looking at both arms. They are both have intact skin, full hair distribution. I don't see any cuts or bruises or bumps. I'm feeling your arms for the general muscle tone, which is good. And now I'm feeling your pulses. And your radial pulses are strong. I'm going to check your skin here. I'm checking skin turgor at the back of the hand, which is good. There's no tinting. I'm checking capillary refill. And capillary refill is brisk. Very good. Now I'm going to check your muscle strength. Let me get you to, so I would test the biceps here. I can't flex this mannequin's arms, but I would test biceps, triceps, and then grip strength. And strength is full and equal bilaterally. Finally, I'm going to get you to repeat some movements after me. I'm going to be checking your range of motion. So Raise your arms out to the sides, then turn your palms up, all the way up above your head. Good. Now bring your palms to the back of your head like this, and then bring the backs of your hands to the small of your back. Good. So I was testing abduction, adduction, external and internal rotation, and those are all intact. I'm going to take a look at your chest now. Let me get you to actually sit up. This is going to be difficult because this mannequin can't really sit up, but yeah, that's not going to work. So what I'm going to do is check the chest. Normally you have the patient sitting up to listen to the lungs. This mannequin obviously can't sit up. So what I'm going to actually roll the mannequin so that you can see what I'm doing. Remember, when you roll someone, you always have the side rail up. Alright, so we have the back of the mannequin here. I'm going to listen. Actually, first I'm going to take a look at your back. I notice the anterior to posterior to lateral ratio is about 1 to 2. I'm watching respirations, and the respirations are not labored, they're equal. I'm going to feel across your back, see. Let me know if there's any tenderness. I don't notice any problems with the skin. Any of that hurt? So there's no tenderness with palpation. Now I'm going to listen to your lungs. Each time I put down the stethoscope, take a deep breath in and out through your mouth. Let me actually go ahead and put these in. Now I'm listening to the right middle lobe. And then just the lateral lung. And then the other side, I would listen laterally to a couple of locations. Okay. And now we're going to check the front of your lungs. So, here we go. Sit you back up. I'm going to pull down your gown for a few moments to check your chest, your respirations, and your heart. Okay. So again, I'm watching the respirations on the anterior. I'm going to listen. Back up for a moment. Everything sounded good. I don't hear any wheezes or extra sounds in your lungs. So your breath sounds are clear. I'm laying you back down now to take a look at I'm going to look at your chest again, looking for your heart function. down your gown